After backlash from residents of Vineyard Town and surrounding areas in Kingston, the Ministry of Health is making another attempt to assure that the people's lives are not in danger with the use of the St. Joseph's Hospital as a quarantine center for the coronavirus. The media was taken on a tour of the facility on Tuesday. TVJ Shemela Pullen reports.
Despite assurances by the Ministry of Health, there is still skepticism about the use of the St. Joseph's Hospital as a quarantine area. And it's easy to understand why. The hospital is situated in a residential and commercial area. This is one of 14 rooms that is being prepared at the St. Joseph's Hospital for possible quarantine of Jamaicans who have traveled from China. The hospital is now empty. The approximately 12 patients that were there were moved to other health facilities. The Accident and Emergency Department was also moved to the health center, which remains open. Persons who want to access healthcare services can also go to the center. The hospital will be used only to quarantine people for 14 days.
We have the capacity to provide them with adequate amenities, food, etc., and the medical staff, of course, to check to see that they are either stable or their condition suggests that a further investigation needs to take place.
The ministry is also facing backlash from residents living in the Shortwood Road area. This upon learning about a facility there which is being used to quarantine people.
It was subjected to an appropriate assessment. It has similar facilities like these, own bedroom, own bathroom, and a nursing staff. And they have done well because already we have quarantined and released persons from that facility. We are looking at other facilities also. There's one in the west now, and there are a few others that we're examining. But again, I say, as is the case with St. Joseph's and the communities around it, the other facility really does not or should not pose any risk to the community.
Meanwhile, there is mounting concerns about how long virus may survive on contaminated surfaces. But Director of Emergency Disaster and Special Services in the Ministry of Health, Dr. Nicole Dawkins Wright, is assuring Jamaicans that the quarantine areas would be safe to use for other purposes once they're no longer in use.
What we do in terms of our standard infection prevention and control measures is to assume the worst possible scenario, and so there is what we call a terminal cleaning procedure, which is a very intense cleaning and disinfection process, which renders the room as safe as your bedroom once we are finished with it.
Shemela Pullen, TVJ News.